Good afternoon, everyone. I'm State Representative Tom Mahaffey. I'm glad to be here with all these wonderful healthcare heroes. Thank you for being here. Thank you for being with us, my colleagues behind us, showing support from both sides of the aisle. House Bill 106, it's been almost a year since it passed the House, and we are still in the Senate. We are here to ask our colleagues in the Senate to pass this bill to make it better for the nurses in their hospitals and where they work. This is something that we need to do. It's something that we talked about time and time again. I fell in love with this bill not because I knew anything about it when it started as a legislator. I was introduced to this bill from the hardworking nurses at Penn State Health. They came to me and they explained to me exactly what was going on, their work environment across the state, not just at Penn State Health, but throughout this Commonwealth, and what was going on. This comes back to 2017, before the pandemic, before the things that transpired in 2020 and made it even worse as an environment as the working condition goes in the environment in hospitals today. So we're here to ask again the Senate to pass this bill, to move it out of committee, to put it to the floor and send it to the governor. We have something today that we didn't have before, and that's 22,000 signatures in a petition that were signed throughout this Commonwealth. Where's that? So here's what 22,000 signatures look like. That's 22,000 signatures. Nope, that's 2,000 signatures. Do I have any more signatures? So we are going to add and add and add to this and continue to add to this until this bill gets accomplished and until these nurses have exactly what they need to take care of patients. The Patient Safety Act needs done. It needs done today, not tomorrow, now. We must do this. This was something that's been talked about for 20 years. And we have worked on this and finally got it out of the House. Now it's time we finally get it out of the Senate and put it in front of the governor and have him sign it into law. So I'm going to turn this over when I move some of these petitions. Hayes, can you help me with this? Great co-sponsor of this bill. So, right, I'm going to set this down here. So, since they asked me to MC this, I'm going to turn this over to Wayne Reich. Wayne is with PSNA. Wayne's been dealing with this for quite a few years, not always for it, but it's come around, and now we have unity in nurses. Yeah. Wayne?
My name is Wayne Reich, and I'm a registered nurse, and I'm privileged to be the Chief Executive Officer of the Pennsylvania State Nurses Association. We represent all nurses in the Commonwealth, nearly 300,000. I'm here to call on the Senate, specifically the Health and Human Services Committee, to have passed House Bill 106, the Patient Safety Act. There's a good reason why it's called the Patient Safety Act, which is why it passed the House nearly a year ago. When today's nurses are assigned too many patients to handle, patient safety is compromised. Highly respected researchers have documented such compromises. Having too many patients per nurse means higher mortality, increased hospital-acquired infections, longer lengths of stay, higher readmissions, and decreased patient satisfaction. The solution? Implementing reasonable nurse-to-patient ratios at the bedside. House Bill 106 is evidence-based. It enacts minimum safety standards for nurse staffing in acute care hospitals, and it ensures that those safety standards will be enforced. Bedside nurses understand the importance of House Bill 106 more than anyone. They are the ones on the front line. They're the ones who work the long hours. They're the ones who are mortally injured when compelled to take or witness actions that put patient safety at risk. They're the ones who experience the stress of not being able to provide the highest level of patient care possible. Nursing is an unbroken tradition that's never lost sight of our charge to give patients and their families the very best care with professionalism and compassion. The safety of our patients comes first. That will never change. And while we've never broken our promise to patients, it's a promise that's becoming more difficult to honor every time politics blocks the way to patient care. And in this case, when House Bill 106 languishes. Patient safety isn't something that belongs to Democrats or Republicans, to union or non-union members, or to any other group that claims to know what's best for patients. We, the nurses, know how to safely deliver the best standard of care for our patients. We, the nurses, know that it is our job to educate lawmakers on ways to remove roadblocks to that care. We, the nurses, urge the distinguished members of the Senate to follow the lead of their colleagues in the House. It is time to pass this bill. Send it on to Governor Shapiro. Finish the job. Commit to patient safety. Thank you.
Thank you, Wayne. Now up, Representative Casey Tomlinson.
Good afternoon, everyone. I'm State Representative Casey Tomlinson, one of the co-primes on the Patient Safety Act. First, I just wanted to wish everyone a happy Nurses Week. As the sister-in-law, niece, cousin, granddaughter of nurses, I couldn't be more thrilled to stand here with you today as we continue to advocate for HB 106. A while back, when I first started working on the Patient Safety Act, I can remember going to my sister and asking her, why does this bill need to pass? Give me a good example. She was working in the emergency room at the time. What she told me next blew me away. I'm sure there are some people here today that have heard it before, but I will continue to repeat it until the governor has this bill on his desk, because I believe it is one of the most compelling reasons as to why we need HB 106 to become law. In my sister's words, I had 4 ICU patients all at once that day. Patient 1 was constantly seizing, and I was trying to intubate him because he did not have an open airway. Patient 2, 70 years old uroseptic patient with a BP of 60, who also needed an IV, but veins aren't visible, so I needed an ultrasound ASAP. Patient 3 was a stroke patient who received TPA, which requires constant neurochecks. So that means you are required by law to stay with that patient 1-to-1 for a minimum of 1 hour. Patient 4 was finally able to get a bed on the ICU floor and needed to be transferred, but was covered in urine and feces, and no one but a nurse can transfer that patient in case something goes wrong along the way. All 4 of those patients needed immediate care, life-saving care, all at the same time. Imagine that. Imagine if that was you, or even worse, imagine if one of those patients was your family member. It's very simple to understand. The more patients versus one nurse equals more room for error. Errors that could cost a nurse their career, and more importantly, cost a patient their life. You become a nurse because you want to save lives, not choose which lives to save. I became a representative to fight for my constituents. They deserve proper health care. Each nurse in my district deserves the opportunity to go to work and do their job. It's not complicated, it's common sense. I want to close by again wishing our nurses a happy Nurses Week and thank them all for all that they do every single day. You will always have my support and my appreciation. Let's get HB 106 done once and for all.
Thanks, Casey. You're doing a great job. Thank you. Absolutely. Next up, from the president of PASNAP, Maureen May. RN. These are the people we need to listen to. The nurses, not politicians. Thank you.
Good afternoon. My name is Maureen May, and as you heard earlier, I've been a nurse for a really long time. I think I'm the senior that was speaking today, almost 40 years in direct care. I've been in the ICU as a critical care nurse. I've been in maternal health, and now I'm working in intensive care. While I work at the bedside, I also serve as PASNAP president, as you heard. And as I approach the end of my career, I always thought my career would be over by now, because it can be. But I can't leave the bedside, and I can't leave this legislation out there. I have to finish. We have to finish this. And the other thing is, I think about, things have changed drastically since I graduated nursing school. And I always say something's really wrong here. First of all, it's profit driven. I don't even recall that being profit driven when I graduated. Also, it's more corporate. And what has happened with having corporate profit driven care is we've extracted relationship based care. So we no longer have relationship based nurses. And that's what we start out with. We don't go into nursing because we want to become rich and do great things as far as, financially. We go in because it's in our heart and we take an oath to do no harm. That's why we do what we do. What I'm worried about is the future. And knowing that there's so many mandating bodies, so much around what I say is stunningly complex care. We do difficult work, is that we need to make sure that we have who we really need, not only here at the bedside. We need to stand up for one another, and the legislators need to stand up and support us. You know, obviously, the answer is, of course, we entered the profession because we love patients, we love to take care of people, and we want to advocate. So for decades, this bill has been around. We're this close, or really this close, but for decades, we've been here before, and now we're almost here. And I don't think I'm going to retire until it happens. We're just so close. So it has progressed so far, and it's so exciting. I just have to say thank you and express my immense gratitude to Representative Humphrey, Representative Thompson, Kozlowski, Representative Khan, and all the others on the stage who have recognized the critical need for this bill and have stepped forward to make sure it happened for us. So I really can only say that the minimum staff patient ratios is necessary. And it should never be a partisan issue. So here we have a nonpartisan issue here, as well as the workplace violence. 19 Republican votes in the House. We just need to get it through the Senate. Last year, the Hospital Association, some other networks went around, the House here, and they just didn't think it was the right thing to do. And the assertion was that we can't fix it. It's a pipeline problem. We all know from the hearing today, it's not a pipeline problem. There are plenty of nurses that are licensed that are not practicing under the license. We know that as a fact. But we also know as a fact that because of not having enough nurses and enough staffing, is that the outcomes are poor, cloudy, cloudy, anything negative that's not supposed to happen. When we take that and we want to do the right thing, because everybody behind here, we all want to do the right thing. So the arguments that's presented from the hospital industry are just similar to when, as they said in the past, the automobile makers didn't want to put seatbelts on, or USDA, as Shannon said in the testimony last year, that, the meat packers didn't want to fall under any type of, safety protections. We all know that that's basic, simple, life-saving measures that we needed. We now at this point have 22,000 signatures and from nurses across the state. I think that's pretty loud and clear statement, don't you? 22,000 signatures. So as we celebrate Nurses Week, I implore the Senate Republicans and the majority to follow the lead of their colleagues who supported us in the House floor last year in June. Let's collaborate on this bill, and let's change the healthcare of Pennsylvania and the Commonwealth for the better together. Thank you. I'd like to say that we at PASNEP celebrated our healthcare champions, and two of our healthcare champions, one of them is going to speak, is Representative Kozlowski, registered nurse and a healthcare PASNEP champion, and Representative Khan, if you don't mind coming up.
Yes.
Yes. Together. Thank you for being here.
All right, absolutely. Thank you.
Hello, everybody. Thank you very much, Maureen. We, Representative Khan and I, have a unique background of not only being state representatives, but we are also both registered nurses, a registered nurse practitioner. So we are acutely aware of how important this bill is to get through. It's through the House. It is through the House. No, it's the Senate, so they need to do their work too. The words of Nurse Wayne, Nurse Maureen, Representative Tomlinson, and Representative Mahaffey, all of those statistics are true. And I graduated nursing school 30 years ago this month. And the patients that I took care of on the floor, now those patients are much sicker, acutely iller, and they need more attention. It is so important. This is about our patients. I know the ratios, and it's called the Nurse Ratio Act and the Safe Staffing Act, but it's really about our patients. We as nurses go into this field to take care of people, and when you cannot give your patients the time that they deserve, it's really hard. It's really difficult, and it's not fair to our patients. So this is so important. These signatures down here speak volumes of how important it is to our constituents, to our patients. I interchange those words all the time because my constituents are my patients, and that's why we are so it is so important for us to be here. Behind me, I stood with the nurses behind me and the healthcare employees and workers and people that take care of patients all day long. It's imperative that we do that for them. So thank you for being here today. I beg the Senate to pay attention to this, to get it through the House, and to really, we have Republicans here today, we have Democrats here today. It is not an issue of party. It is about your own family, your own patients, your own constituents. It is so important we get this passed. So thank you, everybody, for being here today.
Happy Nurses Month. I'm so proud to be a nurse, and I'm really so proud of this bill. I'm so proud to be here with my colleagues from across the aisle, all the nurses that are here, and we have just a great assortment of collaborators on this bill. As Wayne, the CEO of PSNA said, it's not just union nurses. It's not just nurses who are not affiliated with a union. It's also healthcare groups that are supporting it, advocacy groups. There are physician groups that are supporting it. There are healthcare rights groups that are supporting it. I can tell you that, as a legislator, this makes sense. We see what happened in California when they passed the bill. The nurses were becoming less burnout, and they saw that patients' lives were being saved. So it makes sense from a legislative point of view. It also makes sense from a research point of view. I got my PhD from the University of Pennsylvania, and I can tell you that this is one of the strongest evidence-based bills that we have in the House currently. We have evidence that stretches back from at least 2003 showing the impact of what safe staffing ratios like we have in California do. Linda Agan was here. She testified about why it's so important from a research standpoint. And it's not just here in the U.S., it's across the world. We know that nurses, when they have safe staffing standards, their patients survive. There's a lot of arguments that are made against this that are very, I think they're red herrings, really. Because when you look at it, they say that, well, we don't have enough nurses. Well, what happens are nurses are leaving the bedside because they can't stand the toxic condition of having to work and take care of more patients than they can actually physically do. I can tell you that as a nurse, I felt like sometimes I had to be two people in order to, I wasn't able to go to, you had those days when you felt like you couldn't go to the bathroom because you had so much to do. And that's not right. It is not right that the nurses don't have what they have. And I'll tell you one more thing. During the pandemic, we rode the back of nurses. Nurses got us through the pandemic. Relatives were dying. People were dying in the hospital, and the last person that was with them was the nurse. We relied on nurses. And we kept telling nurses, we appreciate you. Thank you. And the nurses have one ask. They're not asking for more money. They're not asking for more vacation time. They're asking simply to have safe staffing. That is the bill. That's what we're pushing for. It's bipartisan. It's time we get this done. Thank you very much.
Thank you, guys. You do a great job. I tell you what, we all introduced this together. Myself, KC, Bridget, and Tariq. We did this because we knew it was the right thing to do. And I want to thank all the co-sponsors that went on House Bill 106. It is impressive to see so many members understand how important this is and why we did this. So my next person up, I think, is going to be Jamie Balsamo. Jamie is from SEIU Healthcare. Jamie, thank you for what you do every day.
My name is Jamie Balsamo. I've been a registered nurse for 16 years, all of which was at UPMC Altoona. All too often, frontline healthcare workers do not feel heard. We're treated as if our opinions don't matter, and we're not cared about at all. Yet we see everything that happens in our hospitals and to our patients, and it truly breaks my heart. Nurses and patients everywhere suffer from short staffing, and I myself I'm an example of the burnout and mass exodus away from the bedside that is plaguing our current healthcare workforce. For the past 3 years, I've worked in the intensive care unit, which is where my passion truly lies. But about 4 months ago, I transferred out of the ICU to the cardiac catheterization lab in order to avoid leaving Altoona Hospital altogether. I just couldn't do another day in the ICU. I couldn't take it another day. I could no longer ethically accept the risks that my patients were facing. Because of the fragile health of intensive care patients, nurses should not have more than 2 patients each. And Altoona has a set of guidelines that states that as well. However, most days ICU nurses have 3 patients each. So it's in total violation of the guidelines and the recommendations. And sometimes I would be assigned as the charge nurse who shouldn't have any patients. And I would have my own critical patients, and I would have a condition keeper, a rapid response keeper, to attend to emergencies in other departments of the hospital, where I would have to leave my critical patient sides to go elsewhere in the hospital to attend to emergencies. On our medical surgical floors, nurses shouldn't have more than 5 or 6 patients, and ours often have 8. This makes it almost impossible to deliver the quality of care we believe in, and leads to a sense of defeat and moral injury. Moral injury is when nurses' core values are violated by our lived experiences. Every day I worked in the ICU, I would wake up and say, I just can't do this anymore. It's gotten so bad recently that our patients have started to speak out. There have been a flood of letters to the editor in our local newspaper describing their horrendous experiences in our hospital. We have to stop putting nurses in these situations. We need to give nurses the support and the resources that we need in order to do our jobs to the best of our abilities to provide the care that our patients deserve. That's why we need the Patient Safety Act, real nurse-to-patient staffing ratios. And it's why SEIU Healthcare Pennsylvania, together with PASNEP, has collected over 22,000 signatures in support of these ratios. We know that giving patients more time and attention would lead to better outcomes and help retain nurses in our hospitals. We need to ensure that we spend our healthcare resources on the things that matter most. We need to focus on patient care, and that's what this legislation would do. So on this Nurses Week, we need more than talk. We need action to ensure safe staffing in our hospitals. Thank you.
Thank you. Now's the time. Let's get it done. These nurses have waited almost 2 decades for this to take place. Let's do a signing in the governor's office, and let's have 22,000 nurses come there to see the signing of House Bill 106. I want to thank everybody. I want to thank all the nurses for everything you do day in and day out. You make our lives better by doing what you do and safer. Thank you so much. Again, I want to thank all of those who helped introduce this, Representative Thomason, Kasparowski, Hahn, and all the co-sponsors for doing what they do. Now it's time to talk to our senators and have them move that out of the Senate and get this in front of Josh Shapiro, the governor. I'd be willing to take any questions if anybody has any. If not, thank you all for coming. Appreciate it.